Welcome, everyone. Thanks for joining our live stream this morning to introduce Clarity's first State of CPS Security report devoted entirely to healthcare cybersecurity. The report was published this week and it's filled with insights from Team 82 research, starting with an examination of the breadth of medical devices that contain exploitable vulnerabilities. It also explains the exposure caused by legacy unsupported devices and systems, and also, it provides an analysis of the architectural weaknesses introduced by connectivity within the healthcare industry, especially around connected medical devices. We believe that healthcare delivery organizations are at a really pivotal point and can no longer afford to be reactive about cybersecurity. It must be a core business and strategic consideration for HDOs and medical device manufacturers alike. We hope this report informs decision makers within the healthcare sector as to where the major cybersecurity issues lie and the risks they must take into account to preserve patient safety and the viability of this critical infrastructure sector. All right, so let's take a look at some of the key findings from our report. And again, I invite you to download and read the report. It's available on claroty.com, and you can also access it from our blog on claroty.com/team82. Just a note that registration is required to access the blog. So, as I mentioned, we focus a lot of the report on vulnerabilities in connected devices, and much of this vulnerability data comes from public sources of information. So, rather than just count vulnerabilities, we looked at the likelihood of exploitation based on data from CISA's known exploited vulnerabilities database, also known as KEVs. KEVs that exist on hospital networks are particularly alarming because these exposures have exploits already that are publicly known, which severely shortens the time to patch for some of these bugs. We learned, for example, that 63% of KEVs tracked by CISA can be found on healthcare networks. And perhaps even more disturbing is that 23% of medical devices, things like imaging systems, clinical IoT devices, and surgical gear, all have at least one known exploited vulnerability. So imagine hospitals, for example, with a handful of imaging systems, things like MRI machines, CAT scans, X ray machines. And those critical systems are unavailable for any significant period of time because of a cyber incident. The potential disruption and impact to patient care could be significant. I want to point out another cool section in the report that you should take a look at as well. That looks at medical devices that contain vulnerabilities with high EPSS scores. So, EPSS stands for the Exploit Prediction Scoring System, which was developed by FIRST. EPSS represents the probability that a vulnerability will be exploited in the wild. And the scores are based on a number of things, including threat information from CVEs and information about public exploits. So, it's really no surprise that we found some patient care devices, including surgical devices with high EPSS scores. For additional context, it's important to understand that many medical devices are running legacy operating systems that are either end of life or no longer supported with security and feature updates. This really puts the onus on CISOs, security leaders, and security teams to implement compensating controls as a mitigation. And there's a bit more data in the report on these unsupported systems, so please check out the paper. Medical device manufacturers are also a bit handcuffed by the sometimes lengthy FDA device certification process and have concerns about breaking functionality already certified by the FDA with the introduction of a security patch. So, all of this just complicates an already complicated situation and extends the exposure that HDOs face. Finally, architecturally, there is additional exposure. The most glaring of which that we report on is the accessibility of some connected medical devices, including surgical devices, on networks that are designated as guest networks by hospitals. The percentages of devices we saw communicating on these networks are relatively small. I mean, 4% of devices used in surgeries, for example, are on guest networks, but ideally, that number should be zero. So that's just a quick sample of some of the information and the data in our new report. I hope you enjoyed our quick preview of the State of CPS Security Report, Healthcare 2023. I invite you to download the report at .com and we hope it's an important resource for you. Thanks for joining us.